Hi everyone, it's Marcus Simpson with Surgery Pro and Associated Medical, joining you for a little bit of unscripted dialogue. We'll see what happens. So this is a little bit of a freedom of thought, a few different things, probably a little bit of a rant, but I'll share some ideas, some experiences, and give you a little history. So about 4 years ago, myself and others started this company, the parent company of Surgery Pro, called Associated Medical. We've been doing a lot of things. We've got a lot of irons in the fire, a lot of various endeavors, a lot of interesting things. We've got some big dreams and hopefully, some interesting plays that we're going to be building. Ones that we want to work in financial services within healthcare. We want to work in equipment. We want to be looking at all of the top end devices, portable, non-portable, application interfaces. I mean, just tons of different stuff that we see being developed in the healthcare marketplace. We also want to be looking at nutrition. We want to be looking at psychology as well. So those are the big things for me. Is one, emotional medicine or psychological medicine, mental health, obviously a component of it, but I think that a lot of mental health has been sort of conscripted by the big pharma, and I think that mental health, a lot of that just starts with meditation. It starts with mindfulness and resting in sort of the ephemerality of existence, which basically means taking less medications and accepting pain and loss as the fundamental elements of life. That's one big can of worms. Another is the physical can of worms. We have really a crisis in this country. Our healthcare system is beyond broken. We know that. Those of us in the field know that. We're fighting every day. Some think that we're actually the cause of that issue based upon our getting reimbursed for certain things that some think that shouldn't get reimbursed, not getting reimbursed for things that we should be getting reimbursed. All those kinds of things. Bottom line is the system doesn't make any sense. And the people that have the power to change the system have very, very little incentive to do so. So, well, maybe I might get into that, but possibly in another video. But the bottom line is the whole healthcare system, the way that healthcare is delivered, the cost involved, it's very, very top heavy. And like if you've been following agriculture over the last couple of years or media, you have 5 major companies in the United States that control a huge percentage of major sectors, whether it's technology, computers, think of the 5, whether it's agriculture, and almost all the food that you eat is coming from 5 or 6 companies in total. And the same thing is going to be true in healthcare. We're going to see 4 or 5 hospital systems that will be dominant throughout the United States, and we will see 4 or 5 insurance carriers outside of Medicare and state. So Medicaid, outside of those 2, you'll see 4 or 5, and that's it. By volume, they will control the lion's share. So we have some issues. We have other issues in terms of obesity. This is the bane of everyone's existence, myself included. It's very, very difficult to go through life and eat a normal lifestyle and not restrict what you do, not eat anything literally from a fast food restaurant for the most part, and be healthy. I mean, the reality is that in order to be healthy today, one is you have to have what we like to call genetic celebrity, which is either really good looks or just really good genes, so that your body is able to take on 300, 400, 500 more calories per day on average, or 200 more per day, etc. You get the idea. During periods of stress where you're sleeping less, you're eating more, all these kinds of things. You have more sugar content and so many different things today. You're retaining more water because just about everything we have is salt. You get the idea. Very, very difficult to be healthy in this environment today. So if you had the genetics, you might be able to burn those calories or your body not store them in the normal mechanism, which is to convert excess fuel into fat. So, mental health, too many people within this country are taking medications, and I know that's, but forget it. This is the truth. We shouldn't be on the blood, we shouldn't be on as many medications, whether it is in depression, whether it's in mood, whether it's in. We need to think about the downsides of being a society that is dependent upon medication. We need to be thinking about the downsides of a society that is mostly sedentary. We need to be thinking about the downsides of a society that doesn't want to listen to the truth. We don't want to know these things. We don't want to have hard dialogues. We don't have the appetite. We don't have a system that teaches young people how to shop for their groceries, how to manage their finances. We don't have a system that teaches them that a college degree doesn't mean anything to a large extent anymore. We don't have a system that teaches them that in the past, not everyone was guaranteed access into an American middle-class lifestyle. And the reality is that the majority of middle-class Americans are not middle-class anymore. If anything, they're lower middle-class. And we've also seen poverty rise and everything else. So it's a really complicated system. There are crises throughout the world. There are crises here in this country. We know about the horrible events that I'm shooting this video a day or two after the terrible events in Boston, the Boston Marathon 2013. But at the same time, we're not looking through a lens that questions maybe enough why. Why are these things happening? And there are a lot of reasons why these things might be happening, and most of them are uncomfortable. So it doesn't matter what you look through, whether you're looking at healthcare, whether you're looking at law, personal wellness, nutrition, professional life, we're struggling. And the whole country is struggling. And no one has, I think, all of the answers. There's a lot of the answers that are out there, but the will to evolve, the will to change is, I think, a little bit less strong than maybe it needs to be. So there's a couple of thoughts.